everyone. Welcome to our Lunch and Learn series. We have Megan Wallis with us today from Conquer Therapy Services. She's going to be discussing how to access therapy services through the waiver, through DMH, in regards to OT, PT, and SLP services. All right, Megan, take it away for us.
My name is Megan. I'm currently completing my project for my doctorate in occupational therapy at Conquer Therapy Services. My capstone project has mainly focused on home and community-based service waivers, which I'll commonly refer to as HCBS waivers. That's typically what people in the community call them. So I have done a lot of research on this over the past 3 months or so, but I find that I am learning something new truly every single day. It's a very complex process. And I'm going to try to pare it down as much as I can within this hour-long meeting to try to make it understandable for you all, but just so that it's enough information that you walk away feeling like you have the resources to access a waiver if that's something that is interesting to you or if that's something that pertains to you, but not so much that it's really overwhelming. So I thought it would be helpful if I just started by talking a little bit about who Conquer Therapy Services is. This is a private practice that's owned and operated by 2 occupational therapists, Jamie Schonoff and Danielle Schenk. We actually have Jamie on the call here today. She has taken on a lot of the work that's gone into becoming a provider that is accepting HCBS waivers. So I'll get into that in the next slide, but Jamie has done this for about 2 years. It's been a passion project, so it's very exciting. And she is also here to answer questions that I might not be able to field for any reason. So those are the owners of the clinic. We have 17 total therapists on staff that are providing occupational therapy, physical therapy, and speech therapy services. And this is done through one-on-one therapy, group sessions. We go into schools, we do home modifications. We are really trying to meet a large population. We see individuals from birth, so we're an early steps or first steps early intervention provider, and we run groups at the we run groups at the Down Syndrome Association with adults who are trying to kind of gain some of those life skills that are so necessary for being successful and independent in adulthood. So we really do see a wide range of clients. We have an office that's located in Creve Coeur. It's on the corner of Olive Road and Mason Road, kind of by Barnes West County. But we do we place an emphasis on natural settings. That's really important to us. So we like to go into people's homes, into their work settings, into schools. Seeing their performance in that setting we found is really beneficial because we see where they are and how we can help them progress in their environment. They're completing some of those activities that we're working on. So that's a little bit about us. And the exciting thing, and this is kind of how this relates to our topic today, we are officially, as of like a month or 2 ago, we are officially an approved home and community-based services waiver provider. So we are an HCBS waiver provider. I will dive into these waivers a lot more, but just on the surface, these waivers allow individuals to use Medicaid funds, otherwise known as Mo Health Net in the state of Missouri. You'll hear that a lot. They're interchangeable, to access various healthcare services. I'll go through a list of some of the services that are covered, but as it pertains to us, occupational therapy, physical therapy, and speech and language therapy are included amongst those. So this is very exciting for us because this is pretty revolutionary in the field of therapy. When we think about therapy, a lot of times there's an emphasis on rehabilitation. So you think about someone who's experienced an illness, an injury, and working on gaining some of those skills that they lost as a result of that event or experience. But this allows us to take a habilitative approach, and that's really focusing on nothing really happened that made these skills disappear. We're just trying to promote, reinforce, make sure that we are able to keep some of those skills and grow on skills that we've already developed. So this is a really unique approach, and we're very proud and excited that we are able to be a part of this space now. I thought it would be helpful if I just set a little bit, give you some context from like where these waivers come from. And like all things government, it can get very confusing very quickly. So I thought it would be helpful if I kind of pared it down into a systems approach. So first, we're going to talk about this larger system, which is the Missouri Department of Mental Health, commonly referred to as DMH. That's going to be our biggest Navy circle over here on the left. The Department of Mental Health is a department that falls under our executive branch in the Missouri government. So there's many different departments. This happens to be one of them. This department functions to prevent, treat, and habilitate individuals who have one of three conditions. So a mental health disorder, a developmental disability, or a substance use disorder. So that's the population we're serving. There are
Larry and Ruth are bringing her home. They insisted.
There's three divisions within the Department of Mental Health, but the one that pertains to us it's most important to what we're talking about here is the Division of Developmental Disabilities, and that's our second circle here on the left. That's our orange circle. This is commonly referred to as the Division of DD, even the DDD. You'll hear some different names. I'll probably use Division of DD. That's what I've been referring to it as. But this division in particular supports persons with intellectual or developmental disabilities by finding the most cost-effective way to meet their needs. And there's a really big emphasis on this word cost-effective. I think that's really what a lot of this comes down to, and I'll get into how that kind of relates to some of the stuff we're talking about. But they're working with families and individuals to meet their needs, but they're really looking at it through an affordable lens. How can we make these services happen without breaking the bank? So that is what their role is. Within the Division of DD, they have a responsibility of administering our home and community-based services waivers, our HCBS waivers. So that's our smallest circle here on the left. I will now dive into way more about those waivers, but just know that these are administered through the Division of DD. So this is just one of the many ways that they are helping families and individuals with disabilities meet some of their support needs. Okay, so a broad overall definition of home and community-based services waivers. These waivers allow individuals with intellectual or developmental disabilities to remain in their homes or a community setting. So that could be at home with their parents, with other family members. A community setting oftentimes looks like a group home these days, rather than an institution. And that's commonly thought of as like a nursing home, a hospital, an intermediate care facility, a long-term care facility, through, again, those various healthcare services, which OT, PT, and speech are just ones of many that are included, and I'll talk about that. And this is funded by Medicaid, and that's known as Mo Health Net in the state of Missouri, as I said. It gets a little confusing because the waivers are a program under Medicaid. So we have Medicaid as a whole, and Medicaid has many different services that it can provide. This is one type of Medicaid. So if I talk about straight Medicaid, I'm talking about the big Medicaid that you can apply for. HCBS waivers are a type of Medicaid service that you can get through the Medicaid program. If that makes sense, I'm hoping it does. Okay, so that's what it is as a whole. Now, to be eligible for an HCBS waiver, there's specific criteria that has to be met. First, the individual must have a severe chronic disability that was manifested before the age of 22 and results in mental, physical, or behavioral impairment in 3 or more major areas of life. And the Division of DD defines those as self-care, language, learning, mobility, self-direction, and capacity for independent living, which really means like the ability to obtain employment and maintain employment. Now, this is all determined through the Missouri Adaptive Ability Scale, which you'll commonly hear is called the MOS. That's what people say. This is the MOS. So the MOS is an assessment that every single person has to take to get their foot into the door of the Division of DD. So not just for getting a waiver. If you want to access services through the Division of DD, every single person has to take the MOS assessment. This is an online assessment. There's a person who helps administer it. It's like a collaborative type of process where they're asking questions, you're getting a lot of information, it's a lot of back and forth. But this assessment is something that's really important, and it determines your eligibility. So that is something that needs to be participated in. Second, you must receive healthcare coverage under Missouri Medicaid. If you are not already receiving healthcare insurance through Medicaid, if you go to the Department of Social Services website, they lay out that process really, really well. You can apply online, you can call to apply. Obviously, I did not go through the process myself, so I cannot vouch for what it is past the information that I saw provided. I'm sure it looks easier than it is, but that is something that will be really important, and I'll get into why that's so important shortly. Last but not least, the individual has to demonstrate the persistent need for waiver services. So this means without these waiver services, the individual's health or safety would be compromised, and the level of care that they're requiring is that of which will be provided in an institutional type of setting. So the persistent need for services, that's a requirement. Once an individual is deemed eligible for receiving a waiver, there are 4 different types of waivers that can be administered. All of these waivers function in a similar way, in the sense that they are all working to prevent an individual from reaching a level of institutional care. They're able to stay in their home or community setting. So that is the purpose of all of these. However, they differ in the sense that they're administered based on the amount of support needs that the person is requiring. So let's start with the first one, which is the comprehensive waiver, commonly known as the residential waiver, because this is the only waiver that covers residential services. So this is often known as like the golden ticket of waivers, because there is no limit on the amount of services that can be received. But this makes sense because if the individual is in a residential setting, such as a group home, there's a higher level of responsibility for the government to keep that individual's health and safety needs met. So there's going to be a higher amount of funding that's going to go into providing that level of care. So this is the waiver that is used for individuals who are trying to live in a residential setting. Next, we have our community support waiver. In my experience, this is the waiver that I found a lot of individuals have the most. This is for individuals who do have a place to live in the community. Oftentimes that'll be at home with their family, but they're really requiring that respite care so that the caregivers, which is typically a family member, can continue to work, keep their job, instead of providing that around-the-clock care that the individual might be requiring. So there's a soft cap at $40,000 per year, which means, by soft, I mean this is flexible. If there is a type of service that is benefiting the individual's health and safety, it will likely be approved as long as it's justifiable and it's allowing them to stay in the setting that they're currently in. I personally know an individual who has a 6-figure community support waiver budget. So this is a flexible limit, but this is really for those individuals who are able to have a place to live at home, but are still requiring a high level of need. So that'll take us to our third waiver, and this is definitely our most unique waiver out of all of them. This is our Missouri Children with Developmental Disabilities waiver, otherwise known as the MOCDD waiver, but you will oftentimes hear people refer to it as the Sarah Lopez waiver. So if you hear that, that's what they're talking about. This is the only waiver out of all of the 4 waivers that support children who are under the age of 18, who are currently living with their parents, but they're not eligible for straight Medicaid. So again, I talked about how Medicaid is at the top. and the waivers is just one of the many types of programs funded through Medicaid. They're not eligible for Medicaid due to their parents' income or resources. Now, what this waiver allows is the government to utilize the child's income to make the eligibility determination. So it waives the parents' income, allows them to only look at what the child's income is, to allow them to be eligible for receiving this type of service. There are mixed things on this. Some people say there is a cap on services. Some people say there's not. Honestly, I don't have the answer as far from what I've seen. I believe there's not really a type of service limitation. However, that's to say the government is always trying to limit things. So as long as it's justifiable and helps the individual, there's always a system that you have to go through for getting things approved. But as far as I know, there's not really a limitation or a cap on the amount of services that can be received. Last but not least, we have our Partnership for Hope waiver. This waiver supports individuals who are only requiring a minimal amount of care in order to continue living in the community or at home. So these individuals might not be requiring that 24-hour round-the-clock care. They might be able to carry out some of their daily activities independently, but it's really preventing some of that decline from happening to ensure that they don't end up in a place where they are requiring that type of high-level institutional care. This waiver, it has a very hard cap, $12,362 per year. You will see that number everywhere. This is a very hard cap for this waiver. So again, this is for individuals who are not requiring a whole lot of services in order to maintain where they're living in the community. Okay, so there are 35 total services that can be accessed through these waivers. They include pod behavioral analysis, assistive technology, career planning, crisis intervention, day habilitation, environmental adaptations, group homes, occupational therapy, personal assistant, physical therapy, speech therapy, transportation. Truly, the list goes on and on and on. If you scan this QR code right here, this will take you to, it's called the waiver manual. This is like the holy grail of everything related to waivers. So it kind of lays out anything and everything related to HCBS waivers. I encourage you to check this out. Specifically, if you look at pages 36 through 38, this will give you a list of all of the 35 services that are offered under these waivers. Now, you will notice that different services are approved under different waivers. For example, as it relates to us as therapy providers, occupational therapy, physical therapy, and speech therapy are not covered under the Sarah Lopez waiver, which is, again, that waiver that's for children under the age of 18, because these type of services can be accessed in a school setting. So Medicaid is not going to cover that because they already have the ability to access therapy services in a different way. Now, for other types of services that are not covered under certain waivers, I don't have the answer as to why certain services are covered and certain services are not. That is a question for your service coordinator, who is the person that oversees your specific case. But all I can tell you is that therapy services are offered under the comprehensive waiver, the community waiver, and the Partnership for Hope waiver. Okay, so I bet you're wondering, how do I know which services I'm authorized for? Like, can I just access anyone that I want? The answer is no. It all comes down to what's called your individual support plan, which people will commonly call your ISP. So your ISP is a document that reflects an individual's strengths, preferences, current services and supports, support needs, and most importantly, their goals and desired outcomes. So the ISP results from a person-centered planning process. It's very collaborative. It kind of feels like an IEP, an IFSP. It's that similar type of collaboration, but it's very person-centered. So the individual will be present, as well as the support coordinator, which is the case manager that oversees the case. And if chosen by the individual, their family, their guardians, friends, advocates, truly anyone that's an important part of their care team. the ISP is required to be reviewed every 12 months, and you will have an annual review date. So if your ISP was established on July 1st, every year you will meet on July 1st to go over that ISP, talk about your goals, outcomes, support needs, everything. However, reviews or revisions can occur upon the individual's request, or if different factors are changing significantly. So not even thinking about just the individual's abilities and needs, but maybe a caretaker who's been a really crucial part of that individual's care. Maybe they have an injury, they're sick. That would warrant creating a revision and calling for an ISP meeting. So everyone's in charge of their ISP. You have the power to do with it what you will. It's really an important document because this is what is guiding our service authorization and dictating the budget. So services that meet the individual's goals and desired outcomes will then be authorized and budgeted for. So I have talked to many individuals, specifically a disability advocate I'm very close with. I'll talk about him towards the end of the presentation. He has told me his number one thing he recommends is that families write their own ISP as well as their own ISP goals. This ensures that you are, this document is really reflecting the individual, their needs, what the family is needing. You can write your goals. If you write your goals, you are pretty much guaranteed to be given the resources that you need to make sure that all of the needs are met. So that's just a tidbit that I thought I would share with you all. Now, here's a question that commonly comes up, and this might only be for certain individuals on this call. What if I don't have certain services authorized? So maybe you have a waiver and you have an ISP, but your ISP doesn't have certain services authorized. Maybe you want OT, PT, speech. I mean, any other service, truly. It doesn't have to be just the ones. It's just, this is just how it relates to us. If any of those 35 services are something you think would benefit your child's health and safety, and it's not currently on your ISP, here's what you do. First, you have to ensure that you have exhausted all other available resources. And this is what's really important. Medicaid is a last resort payer. They're going to find any other way to ensure that your needs are being met without pulling funds from their pocket. So they are a last resort payer. And that goes back to that definition of the division of DD. They're finding the most cost-effective way to meet your needs. So the first thing that anyone should do is exhaust all of your other available resources. I'm talking private insurance, straight Medicaid, natural supports in your environment, even accessing grants, trust funds. There are so many different possibilities from where you can get funding for some of these services. Waiver services, that's pretty much the last resort. They will authorize this if you can't get it any other way. So hold on to those denials. As sad as they feel, they will actually help your case. They want proof that this is really the only way that you can get this service that you so badly need. So after you have exhausted all of your options, then you can approach your service coordinator and tell them what service that you're wanting, why you can't get it through any other way, and show them the denial that I can't get this and why you would need this. From there, they might add this requested service if it aligns well with your ISP goals. If it doesn't align well with your ISP goals, present them with a goal. Say, hey, there's a new goal that I'm wanting to add to my ISP. Once they add that, that might be enough to warrant approval for that service, because that directly relates to the goals and outcomes that you are looking for. So again, the ISP is so important and truly guides the whole process. I won't spend too much time talking about this, but there are great ISP planning tools out there. There's a company called Life Course Nexus, and they have kind of a program called Charting the Life Course. And if you scan this QR code here, you can access all these different types of tools that I really do encourage you all to check out. You can look at the Life Domain Vision tool, which breaks down visions for the future into different categories. You can talk about that. The trajectory for planning, it highlights your past experience, current experiences, and to make a plan for how that can, how those should be used and can be used to guide you towards your goals for the future. And last, the integrated support star allows individuals to identify the supports they're currently utilizing and consider additional supports that could be accessed for making some of your goals happen. So you could really take a lot of this information and plug it into your ISP. This is a great tool. So if you're looking for something, you're like, that is too overwhelming, these really help break it down into different categories. And there's more worksheets than just these on there. There's some that talk about relationships and everything. So check this website out. It's a really great tool if you're just looking for a way to kind of get clear about what you're wanting. Now, this is the really important part. So you know about what waivers are and how they function and what you can receive, but how do you get them? Number one, the first step, you need to apply for and obtain Missouri Medicaid through the Department of Social Services. Again, if you go onto their website, they lay out that process nicely. You can apply online, you can call. It didn't seem too difficult to me. However, that is easier said than done. It probably is difficult. To get your foot into the door, you have to have Medicaid. That is the first thing. If you don't have Medicaid, you can't do any of these. You can't get a waiver, you can't get services through the Division of DD, none of that. After you have Medicaid, the second step is to contact your DMH regional office. I included a link here with the contact information, but I'm realizing now that you're not able to access that. So I'm going to send that link to Linda and she can share that with you all. It breaks it down by county. So you will contact the county that you are in, and they will guide you to the intake unit. The intake unit is responsible for determining eligibility and admission into the Division of DD. They go through an extensive intake process that requires like a whole application packet. And then, as I was talking about, participation in that, in the MAS, the Missouri Adaptive Ability Scale. So you will have to participate in that. What this assessment will do is generate a report on functional areas of limitation, and that directly relates to those 7 areas, major areas of life that we talked about, like mobility and language and self-direction and capacity for independent living. It directly assesses all of those areas, and it'll give you a breakdown of abilities within those areas, and it'll most importantly give you what's called a prioritization of needs score, which people call a PON score. I'll get into a little bit about why this is important, but this is a 1 through 5 score, which talks about how, trying to find a good way to put this, the level of need. So an individual with a PON score of 2 would have a lower level of need for services than an individual with a PON score of 5. Same thing with a 1 and a 3, a 2 and a 4, a 3 and a 5. An individual with a 5 is going to have a greater level of need than an individual with a PON score of 1. And again, I'll talk about how this matters in a moment. So after you go through that whole eligibility process and you are deemed eligible, you will be assigned a service coordinator. Now, a service coordinator is pretty much your case manager. They're overseeing your whole case for everything Division of DD related. The service coordinator will work closely with the individual and their family to create that ISP. From there, they are going to connect them with a bunch of different resources in the community, different services, to try to meet some of those support needs before dipping into Medicaid funds. So they're going to connect you with a bunch of different places. I'm sure the Down Syndrome Association would probably be a place that they would connect them with. So places like that, they're going to connect you with all of those great resources. And this is what takes us to our waivers. If you are requesting a service and you cannot get that service through any of those great community resources that they have offered you, and every single other method that you have tried, so you've gone through your private insurance, you've gone through straight Medicaid, You've tried to get a grant, you've tapped into trust funds, truly anything. You have exhausted everything and you have been denied. And the service is justified through their ISP and their health or risk is at safety without the service. This is what's going to trigger that process of initiating the HCBS waiver. So what's important about this is that you are requesting a service, you are not requesting a waiver. If they cannot meet your service need through any other method, that will automatically start that waiver process. So that's important to note. You're requesting a service, you're not requesting a waiver, even though you might know that you're requesting a waiver. From there, if that requested service is deemed reasonable and necessary by this fancy committee called utilization review, they are the gatekeeper of services, so they're pretty much in charge of everything, and they're meeting the eligibility criteria for the waiver that we talked about earlier, the individual will be deemed eligible for receiving an HCBS waiver. And you'll be administered one of those 4 types of waivers based on all those individual traits I was talking about: age, living situation, support needs. You'll be administered one of those 4. Now, the tricky part, there could be a wait list for a waiver. And this is where that PON score, that prioritization of need score, comes in. An individual who has a PON score of 2 is going to be placed lower on the list than an individual with a PON score of 5. Even if the person with a PON score of 2 applied for it months before the person with a level need of 5. Which makes it a little bit frustrating, and there's no timeline on how quickly or how slowly these things go. And Jamie and I talked to an individual who actually works with the Department of Mental Health, and he's like, I don't even know if there's a wait list right now. It's just every 5 years they determine what the budget is, how much money can we put towards this program, and that's really guiding how many slots are available. So once a slot opens up and you're in line in that list, and that's when you are administered a waiver. So it's a lengthy process, but that lays it all out. So now you know what to do. I'm sure you're thinking, well, great, what do I need to do? So you're going to be thinking about your individual case in this. Okay, so the first thing you need to do, the most important thing, is determine where you currently are in the process. So the first thing you need to ask yourself, do you have Medicaid? If not, you need to apply for Medicaid. Do you have contacts at the DMH regional office, DDRB, CHS, or DD resources? These are all of the groups that are supporting individuals like in our St. Louis County area. If you have contacts there, that means you probably have a service coordinator. That means you might have a case that's already open at the division of DD. Do you have a support coordinator? If not, you should probably get one of those. Do you have funded services through an HCBS waiver? I was talking to a family recently. They didn't even realize that they had a waiver. So think about, what services am I currently being funded through the Department of Mental Health, through the division of DD? You might have a waiver and you don't even realize it. And maybe it's just the case of calling for an ISP meeting and tacking on different services that you feel like would meet those goals and objectives that you've laid out. So determine where you currently are in the process. From there, you will need to identify those steps that need to be taken to move forward in the process. It's easier said than done for me to say, contact the DMH regional office. A lot of people have had very mixed experiences with the Department of Mental Health, as I have found myself after talking with a lot of families and different individuals. So there are community resources that are out there. You can hire a private advocate who will oversee your specific case and talk about how to get different services approved. Easter Seals Midwest and St. Louis ARC both have programs called Family Navigators that will work with individuals and their families to help them navigate this process, navigate different services. They can be people that you can go to for this. Online family groups, MOSDS, that's Missouri Self-Directed Supports. I know many individuals who are in that community. They have a website. They have meetings. I don't know if it's once a month. They are a great resource for families, even to just connect and talk about different things that they're doing that might help you in the end. You should ensure that you're exhausting all of your other support and resource options. I know I've kind of talked about this way too much, but again, Medicaid's a last resort payer. So you need to make sure, if you want a service, try to get it any other way. if you end up getting it, that's awesome. Then you get the service you want. If you can't, hold on to those denials. This will only strengthen your case for getting a waiver, or your services funded through the division of DD. And last but not least, call for an ISP meeting. Add a goal, change a goal, revise a goal, delete a goal. You have the power over your ISP. And again, this is what's dictating what services are authorized, what's the budget for these services. The ISP is truly the guide and the gate to everything service related. So make that a priority. There are many individuals in the community that help with these types of things. If you're looking for specific individuals, we know these people, we trust these people, we've worked with them. They have helped us navigate this process so much, like truly they've given us so much of their time. And these are people that have said, feel free to give my name and contact information out. Families are more than welcome to contact me to get help for their specific case. So first we have Larry Opinski. He has his own company called STL Advocate. He works with individuals privately to help them access the services that they want and need for their child. So not only is he a disability advocate, but he has a child with a disability. He's gone through this whole waiver process. He knows more than anyone I've ever met. So he has helped me immensely, and he would be a great resource if you're looking for someone to privately and personally manage your case. Matt Wagner is our second person. He actually is like the director of the information specialist system, which is a system through the Department of Mental Health. So he's actually in the government system that is administering all these types of waivers. However, he takes on more of a Medicaid side of things, but he has so much knowledge. He is also a parent of a child with a disability. And so he knows this process like the back of his hand, both from a professional standpoint and a personal standpoint. So he said to call this number toll free. He said it mostly likely will go to a voicemail system, but he said he will probably be the one who will be returning your call. He said he understands that this is an exhausting process, but he said if you have the energy to do one thing, pick up your phone and call this number and we will help you figure out the rest. So I thought that was a great comment that I would pass along to you. There's also an email that you can reach out to as well. So those are some people in the community that if you are feeling so lost, and again, this was just a general overview. So this does not even talk about your individual case. These people can really help you get into the weeds of it and figure out what do I do and how can I get my service needs met.
I do want to take a moment just to one, thank you for your time.
Absolutely.
Education and resources, not only from you, Megan, but also just Conquer Therapy has been, and everyone there has just been wonderful to work with. So we definitely appreciate you all with not only this webinar, but for past and future opportunities as well. So I do appreciate that.